So our patient's 42, okay? She looks great, but she has this problem area, okay? Excess adipose tissue where neck liposuction would certainly look good, but she also has this loose skin and this jowling. So instead of getting a full-on neck lift with the big scar right here, we're gonna do a no scar neck lift, meaning a tiny little scar right here and avoid the big scar over here. And what that's gonna do is gonna get rid of all this adipose tissue like the neck liposuction. We're gonna do jaw contouring liposculpture here. We're gonna do Renuvion J-plasma skin tightening of this underlying tissue. And we're also gonna do a CO2 laser and follow it up with the venous legacy treatment to treat the underlying connective tissue fascia underneath here for a neck lift result with minimal incision and downtime. So we're going to start with our liposculpture. I have several different cannulas I like to use, and they have all different features where I want to use them. We're going to do through this little port here, tiny little port protector that protects the skin incision. And we're going to go through and do our liposculpture first, okay? Once that's done, we're going to do our next step, which is our Renuvion or J-plasma, which is this device right here. And what it does is it goes in and it heats the tissue underneath, okay, so that it tightens the skin. All right, that's the major tightening effect of this procedure. Okay, we're gonna do all through the same incision here. We're gonna go in, tighten everything up, and then we're going to close it, do our CO2 laser, and then follow it up and post-op with the venous legacy recovery, radiofrequency tightening to heat the underlying tissues and help with the swelling. This is a jowl extension, so we're going to go up on and suction this jowl so that it sinks into the jawline and gives us better definition. So you see the J-plasma, it kind of arcs right here. That's going on inside. It's tightening on the inside. So we're closing up in multiple layers. This is the only incision that anybody could possibly see here. And it's super tiny, it's hidden in the chin crease. No one's gonna see it. So our next one we're gonna get started with is the Active FX. Okay, that is superficial tightening of the superficial wrinkles. And we're gonna stay pretty light because of her skin color here. Make sure that it gets a nice result but not hyperpigmentation. Recap, we did our liposuction and liposculpture first. We got about 150 cc's out. That's important for this jowling area and this extra volume that's underneath here. Then we followed up with our J-plasma skin tightening for the neck. That way we avoided the big scar right here. For a traditional neck lift, you need a big scar like that. We had a tiny dot right under here. That's why we have a no scar neck lift. Did our Renuvion, tighten the skin very nicely for her. This is good for medium to small amount of laxity candidates. If you have a large amount of laxity, a traditional neck lift might be a better option for you, okay? Make sure you check with your doctor or let us know in the comments. Now, one we did with the J-plasma, we heated up that tissue so it tightened up in this vector, and then we evacuated all the extra air out of there. Remember, there's helium and J-plasma going on at the same time to safely tighten that area. And then we followed up with our CO2 laser to tighten the outlying surface and the fine line wrinkles. We did a nice, beautiful closure. And in the office, we're gonna do venous legacy to tighten the underlying tissues. Now, if you have more questions about no scar neck lift, check out the website, noscarnecklift.com. Feel free to leave your comments, questions, feedback right here on my YouTube page. And if you like this option for you, give me a thumbs up. And if you want to see more videos like this, hit the subscribe button. Thanks so much. All right, everybody, here's our patient. She is 4 months out from her no scar neck lift. This is her neck before, and there was no neck lift surgery, but boom, look what we have right here. Okay, that's a combination procedure we did of that internal tightening and the liposuction. Beautiful result that she has here, and the skin looks great, everything home run.